Opioid overdose is a serious and potentially fatal situation. If you suspect that someone is experiencing an overdose, we want you to be prepared to help them. The most common signs of an opioid overdose include slow, shallow, or stopped breathing, choking sounds or snore-like gurgle, pinpoint pupils, confusion, a slow or irregular heartbeat, cold, clammy skin, or blue lips and nails. They may even lose consciousness and be unresponsive to voice or touch. If you think someone is having an overdose, lay them flat on their back and check to see if the person is breathing. Try to wake them up by shouting their name, shaking them, or rubbing their chest with your fist. If they are unresponsive, administer Narcan. To administer the nasal spray, insert the nozzle into one nostril until your fingers are against the base of the nose and press the plunger firmly. Do not do a test spray before giving the dose. Using Narcan on someone who is not experiencing an opioid overdose isn't harmful, so if you're in doubt, go ahead and administer the Narcan. Next, move the person on their side into the recovery position. Put their hands under their head and roll their knee forward to help them stay on their side. Then, call 911. Tell them you're with someone who may have overdosed on opioids and you have administered Narcan. Answer any questions they have. Then continue caring for the person who overdosed. It may take more than one dose to revive the person. If they have not responded in 2 to 3 minutes, administer another dose in the other nostril. Then put them back into the recovery position. And be prepared. They may wake up abruptly and be startled and confused. Standing or sitting behind them is recommended. They may also go into immediate withdrawal and be irritable or restless. They may feel nauseous, have an increased heart rate, or experience body aches, chills, sweating, and may even need to throw up. Try to keep them calm as you wait for emergency services. Once emergency services arrive, it's important to give them all the information you have about the person's condition and any drugs they may have taken. Be honest about the situation and the drugs that were taken. If you are with someone experiencing an overdose and drugs are in the room, you are protected by Nebraska's Good Samaritan law. Under this law, people who call 911 during an overdose cannot be arrested, charged, or prosecuted for possession of small amounts of drugs or drug paraphernalia. If you or someone you know is struggling with an opioid use disorder, don't hesitate to reach out for help. Together, we can work to combat this public health crisis.